It is my pleasure to present the award for Outstanding Career Public Servant at the local level to Dr. Sam Page, St. Louis County Executive and member of the St. Louis County Council since 2014. Prior to stepping into the top role in the county in 2019, Dr. Page was a full-time anesthesiologist at Mercy Hospital and an adjunct assistant professor at St. Louis University School of Medicine. Dr. Page has always brought a physician's perspective to this work in St. Louis County government. His colleagues at the Missouri State Medical Association credit him for leading his county's fight against COVID-19 using evidence-based approaches on masking and vaccines despite strong political pressure. He is also credited by MSMA for the establishment of a local prescription drug monitoring program, an important clinical tool to assist physicians in making prescribing decisions. Missouri was the last state in the nation to create a PDMP. To get around the legislature's intransigence, Dr. Page initiated and championed legislation to create a PDMP in St. Louis County, allowing other counties to opt in. The local PDMP expanded to cover 85 to 90% of the state's residents and physicians before Missouri finally enacted a statewide PDMP last year. In a letter supporting Dr. Page's nomination, former AMA President David Barb writes, "It is uncommon for a nominee for this award to have been involved in such a broad range of governmental service and to have been so impactful at each level." Dr. Page, we wholeheartedly agree. Congratulations on being this year's Outstanding Career Public Servant at the local level.
Hello, it's an honor to accept this award. I do so aware that I'm standing in for the true heroes of local government in a pandemic: the doctors, the nurses, the healthcare staffers, the communicators, the administrators, and the auditors. In neither of my careers, as a physician and as an elected official, have I ever seen a time like the one in which we now find ourselves. Never have doctors been so urgently needed and our advice so aggressively disparaged. This pandemic has shown the short-sightedness of decades of underfunding almost every aspect of public health and the tragedy of systemic inequities that have left poor people, people of color, and people with disabilities so much more vulnerable than their neighbors. My challenge in St. Louis, our challenge in the United States, is to meet the current health and economic emergencies while redesigning the institutions that largely have failed us. It's a daunting task made lighter by this award and the hard work of each of you. Thank you to the AMA, my colleagues, and especially to my family.